Good afternoon. My name is Shelby Fortner. During this presentation, I will explain the characteristics, type of agent, treatments, and prevention of the disease. The disease I have selected is Giardiasis, also known as beaver fever. Giardiasis is also known as beaver fever after an outbreak in which hikers at a national park in Canada became ill from drinking stream water contaminated with Giardia from beaver droppings. An estimated 20 million people worldwide are infected each year. Giardia infection can result from ingesting contaminated drinking water and touching your mouth or food with infected hands. These parasites can live in the intestines of many mammals, including humans. Giardia are found in backcountry streams and lakes, but also in swimming pools and spas as well. You can contract Giardia if your hands become contaminated. Parents changing a child's diaper are especially at risk. People who do not have access to clean drinking water are at a very high risk for infection. Children are also at a high risk for infection because they are more likely to come in contact with feces. Giardia infection characteristics include diarrhea, bloating, flatulence, abdominal cramps, nausea, fatigue, and weight loss. Symptoms usually begin 3 to 7 days after exposure and can last 2 to 6 weeks. Call your doctor if you experience loose stools, abdominal bloating, and nausea that lasts longer than a week, or if you become dehydrated. Be sure to tell your doctor if you have recently traveled to an endemic area or if you've swallowed water from a stream or lake. Giardia is almost never fatal in industrialized countries, but individuals may still experience intestinal symptoms and complications long after the parasites are gone. The 3 most common complications include dehydration, failure to thrive, and lactose intolerance. Dehydration often is a result of severe diarrhea when the body does not have enough water to carry out normal functions. Chronic diarrhea from a Giardia infection can lead to malnutrition and a failure to thrive. Many people often develop lactose intolerance, the inability to properly digest milk sugar after a Giardia infection. If left untreated, Giardia can lead to complications like arthritis or damage to the cells that line the intestines. Some people have symptoms, some people do not show any symptoms, but can still pass on the disease to others. Giardia lamblia is the causative agent of Giardiasis. Giardia are found worldwide, but only Giardia lamblia causes infection in humans. It is the most commonly identified parasite in the United States, according to Medscape. Giardia is a type of agent called a flagellate protozoan. Once Giardia have found a host, they attach to the intestinal wall and replicate within the gut. Before the parasites are passed in stool, they are protected by a hard outer shell called a cyst that allows them to survive outside of the body for long periods of time and makes it intolerant to chlorine disinfection. The protozoan Giardia is able to move by a thread-like structure called a flagellum. In order to find the correct treatment, a diagnosis is key. To diagnose Giardiasis, 3 tests may be performed: an antigen detection, trichrome stain of stool, microscopic examination of stool. Several drugs can be used in the treatment of Giardia infection. Effective treatments include an antibiotic like Flagyl to stop the growth of bacteria, and an antiparasitic medication like Alenia to kill the parasite. Rehydration is also key to a quicker recovery from a Giardia infection. No drug or vaccine can prevent a Giardia infection. Common sense precaution can go a long way towards reducing your risk of infection. The best way to prevent a Giardia infection is to wash your hands, purify wilderness water, and keep your mouth closed while swimming. It is also recommended by the CDC to wash or peel fresh fruit and vegetables before eating. Here is a picture of what Giardia parasite looks like inside of the body. In conclusion, Giardiasis, beaver fever, is a common, very uncomfortable diarrheal infection that you do not want. If infection does happen, treatment is available, but remember to only consume clean drinking water and wash your hands often and thoroughly. Thank you.